Of course. Morning.
Everybody. I'm Cheryl Strathman. Lucky to be the new chair of the Public Health Committee. The time being 9 o'clock, I'd like to call the Wednesday, December 21st, Public Health Meeting to order. Clerk, please call the roll.
Juby. Here. Silva. Here. Tarver.
Here.
Williams.
Williams here.
Young.
Here.
Strathman.
Here.
Sanchez.
Sanchez present.
Pirog. Tepe.
Duffy here.
We have quorum.
I'd like to ask for unanimous consent to approval of the minutes from November 16. Anybody?
Move it, Rick.
So moved.
I wasn't here. Second. Second necessary.
Any questions or corrections or anything? Okay. And the finance reports are attached. And do we have any public comments? I don't see we have any.
Oh, you got lucky.
I got lucky, yeah. Okay, I'd like to turn it over this morning to Mr. Isaacson.
Excellent. Thank you very much and welcome. We look forward to working with you in this new role. And welcome to the new board members. We look forward to working with each of you as well. So today we want to spend a little time, taking that right to the edge there. It's a little time just kind of going over the health department and what we do, just as some background. And then if there's additional questions, we can get into that. Do you have the presentation, Blair? Sorry.
Yeah.
There we go. So we'll start at a high level and share what each of our groups do, what our main program areas are, and then as we move on in future meetings, we can get into more detail. We'd like to bring staff in and have them represent the great work that they do. And of course, at certain times, we're going to be drilling into specific program areas. So just a little background, actually, the Kane County Health Department is one of the youngest health departments in the state. We were just formed by resolution in 1985. I point out that we were formed by resolution. So the county board voted to establish the health department. That's not the usual mechanism. So as a result of that, you all, as the county board members, serve as our Board of Health. I believe we're one of two counties in the state of Illinois that operates that way. We also then have a public health advisory committee, which serves the role that typically a Board of Health would do in terms of having doctors and nurses and dentists and things to provide us health information. But it's not the same Board of Health mechanism that you may see in other places. We do have an administrative office in Aurora, which any of you are welcome to come and visit anytime. We also have a smaller satellite office up in Elgin, so that we can provide services to the public in north and south part of the county. Again, if you'd like to see either one of those buildings, let me know and we can set up a tour. And then we do operate a balanced budget. We get just under $2 million in local revenue from the county. We are a special fund. We've received $2 million, just under $2 million this year, 5 years ago, 10 years ago, 12 years ago. So as you can imagine, with healthcare cost increases, raises, the cost of gas, whether it's natural gas to heat our buildings, gas for the vehicles, et cetera, our net local investment has been pretty modest in the health department. So we always operate within our means, but there is tremendous need out in the community. So we're always looking at grants. We're largely grant funded, as a matter of fact, but there's a lot more that we could be doing at the health department. So just showing how our grants are structured. This is showing what we presented as part of our budget presentation. And so we were in 4 divisions, and each of the boxes down below represents one of our cost centers. And then starting at the 4th line or below, everything below the 3rd line, those are individual grants. So you can see that grants really are driving a lot of what it is that we're doing here in the health department. So it's great when we can bring in grants. We're going to talk about some new funding that we got today, which is very exciting. But also living kind of hand to mouth like that makes it harder to plan long term. Some of these are time bound grants where we may only have them for a couple of years. Naturally, when somebody gives you money, you're bound to the deliverables that they come up with, which is different than us sitting back and saying, okay, what's the best thing for our community? We try to go for grants that are going to meet our needs and that are mission aligned. But we also have to jump through the hoops that any funder has, and we serve as a funder in many cases. So I don't necessarily mean that as a negative. This is looking at our org chart. So a couple of things that I'll point out here at these meetings every month. I'm shared with share time with our directors. So you'll hear in a couple of minutes. Uche Onwuda is our director of health protection, and Laura Barrett is our director of disease prevention. Online, we have Kenel Snowden, who's our director of finance and facilities. So we have a really strong team. I'm making a change and am splitting some things up. So we'll be bringing in 2 new directors. This is not going to add any additional cost. I'm transitioning 1 assistant director position that was funded at a director position, and then actually reducing a deputy director position down to a director position. 2 things we want to do with that. I'm creating a director of planning and information management position because one thing that's really important to me is we really need to improve how we're able to get information out to people. So whether that's policymakers on the county board so that you know what's happening in your district. We've been talking a lot about mental health funding with townships, looking at what's happening at the municipal level. We need to capitalize better on technology and really be looking into the future about how do we gather data, how do we analyze it, and then also how do we put it into a format that's really usable for people. So on the left, we have facilities. We're going to have director of planning and information management, which also includes our emergency planning. So a lot of good work going on there. Community health is an area where there's a lot of growth opportunities and there's a lot of grant funding that we've been getting. So splitting those out will actually allow that person to spend more time focused on that because there's a tremendous amount of work to be done there. That includes our mental health efforts, along with some other really important things. And then disease prevention and health protection. We're going to get into these in a little more detail, so I will skip forward. So I'll start with just at a high level what we do with finance and facilities. And I'll turn it over, Mr. Snowden. Is there anything that you want to highlight for your group at this point?
Nothing to really highlight. I think the highlights are there. That we have we're not a large department per se, but we are a fairly complex department because of our funding sources. And so the county fiscal year is December through November. And unfortunately, because of our grant fundings, we have to add an additional 7 different fiscal years and grant years. So grants actually overlap into multiple fiscal years. So when we're always budgeting 2 and 3 grant years into a fiscal year. So it's pretty complex. And so we're basically closing the books on an annual basis with these grant years and our normal fiscal years about 15 times a year. So it's, the thing that's not there, but it's just part of the accounting part, is billing. So most of the grants are cost reimbursable. So basically it means we spend the money and get the money. So we have several balls in the air. And because we are a special revenue fund and we're mandated to be a balanced budget, but we're also mandated to be a balanced budget regarding the grants. And so if you consider, so the grants are each one are considered, for lack of a better way of saying it, a project. And it has its own revenue source, which is the award, and its expenses. So we're not looking at one annual budget. We're looking at 37 balanced budgets that we have to do each year. And because of, again, the crossover into multiple grant years, it's closer to like 37 plus budgets, or sometimes even twice that. And we're also subject to a review and sometimes hardcore audits regarding these grants. So we get reviewed a lot, audited a lot, And so there's a lot going on behind the curtain, and it's there, it's happening, and we have in the past, and looking towards the future to continue to not receive any audit findings and to be able to comply with the grant deliverables and requirements regarding the accounting as well as the reimbursements on a timely fashion to avoid any disallowed costs so that we don't waste any of our funding dollars or spend money that we didn't originally have budgeted. That's the long and short of what's happening here. But any questions, I'd be happy to answer.
Any questions?
Right, thank you, Canal.
You're welcome.
So moving on, I'll turn it over to Uche Onwuda, who's been with the health department for a long time as well as me. So or you want it?
Yeah, you can, that's all right. Yeah. Good morning. My name is Uche Onwuta, and I've been with the health department 23 years, I believe. I've been a King County resident 26 years. Just a little bit about me. I have a master's in epidemiology and another master's in microbiology. So I'm here to talk to you about our Division of Health Protection, which I am the director. We have two sections, environmental health and communicable diseases. And our assistant director, Julie Wiggle, for environmental health, and April Elliott for communicable diseases. Next slide. Oh, one thing I wanted to mention in the other slide is what the wheel that's up on the right is, the essential services of public health. And we have part of the assessment, assess and monitor population health, as well as investigating diseases and creating policies and plans and laws and utilizing legal and regulatory actions. So, we touch on most of the essential services, but those are where basically most of our services are in. Next slide. So for the environmental health section, oh, what happened to, the slide is blank. Oh, there you go. The environmental health section is mostly educating the public and enforcing laws and compliance, as well as abatement like in lead. So we have a food program, with the restaurant inspection, grocery stores, different levels of food inspection. And then our well and septic, permits, for those who have wells and septic, ultimately to assure that we have clean water and septic system. And for lead, mostly lead abatement, we have lead is in two programs, one in disease prevention, and the environmental health part of it is in environmental health. Essentially, we're in charge of inspections. When a child has a high blood lead level, we would go out and do inspection and do the abatement, while disease prevention is the case management side of lead. We also have vector control, like we have with West Nile virus and ticks, tick-borne diseases. We also have tanning. We inspect tanning facilities, and we handle property maintenance calls, burning, the county burning ordinance. We also have air quality, which is essentially like radon, education about radon and air quality. And we do quite a lot of FOIA, both in environmental health and communicable diseases. Next slide. For communicable diseases, essentially similar to environmental health, we enforce laws in communicable disease as well, but the main goal is to detect disease and mitigate further spread of the disease so that we can improve and prevent the disease. And sometimes, we're able to learn from the spread of the disease so that in future, if it happens again, we'll know how to handle that. So mostly in communicable disease, we do case investigation and contact tracing. So if somebody is sick, you want to know why they're sick, what happened, who they're exposed to, and where they could have been exposed. We do surveillance, to keep track of the level of disease in the community. As I said, we enforce laws, investigate outbreaks, and essentially we liaise between IDPH, CDC, other health departments, with partners in the community, the hospitals, the schools, many times interpreting new regulations, new guidances, and then reporting back to the state or CDC. So, a lot of consultations and information sharing with our partners. We do a lot of training, health education. Like I said, FOIA requests and data requests. Even in the thick of the pandemic, we still have to do all that. So the areas in communicable diseases is, general CD, general diseases, Ebola is one of them, West Nile virus disease, Salmonella, foodborne diseases, all of those are under our general CD. The sexually transmitted diseases, HIV, AIDS, COVID-19 is its own section right now. And, essentially epidemiology, and under epidemiology, we have outbreak investigation. Next slide. So I just wanted to put this in here. We have a lot of statutes, the state statutes and county ordinances that we, both in environmental health and communicable diseases, that we enforce. And some of them are listed here. I think this is my last one. Next slide. I think this is the last. Thank you. I'll take any questions.
Have any questions? Thank you.
Excellent. I'll turn it over to Laura Barrett for disease prevention.
Hi, I'm Laura Barrett, Director of Disease Prevention. My background is I've been a nurse here in Kane County, and I've lived in my entire lifetime in Kane County, but I've only been with the health department for about 2.5 years. I've had various roles throughout Kane County as a nurse. I've been a nurse for 40 years this year. Started when I was 12. I also have an assistant director, Teresa Knopf, who has a BSN, an MBA, and a master's in public health. Nursing supervisor, Lisa Bloom, who has a master's of science, BSN, and RN, and our program manager, Mari Pena, with a BSN. Next slide, please. I'm going to go through each one of our programs just very quickly. I put information on here. I know you got a copy of this. Many of these programs have referrals, so these are opportunities that you can have for your community and your constituents that may need these services. You can reach out, and I put the information on each one of those. So we're going to start with our coordinated intake. This is funded through the federal government that goes to the state. This is grant funding for the maternal infant early child home visiting program. Is right now in that omnibus program that's about to be signed in Congress at Washington, with an update and review of this funding for this source. So it's got good bipartisan approval, and rightly so. This program here, we have Katie Glump that oversees this program with about 12 different home visiting programs in the entire county. They serve vulnerable populations of women that are pregnant and up through that child's second or third birthday, depending on the evidence-based program that they provide. So these are parents as teachers, healthy families, nurse family partnership are the programs that we work with in our county, largely based in Carpentersville, Elgin, and Aurora in our high population areas, but looking to serve anyone that's low income, low education. They support domestic violence, substance use, and helping to have that positive pregnancy outcome and getting that family set up as best as possible. We work closely with DCFS in these cases also. And then if you have anyone in your that you know or in your area, please refer them on in. There's the phone number, the email, the website, any of those areas will reach us and we'll get those taken care of. Next slide. Our high-risk infant follow-up, all of our hospitals in the county are mandated to report any adverse pregnancy outcomes. So these are the women that have delivered maybe premature infants, maybe there's Down syndrome, could be sickle cell, they could be positive for cocaine or marijuana possibly when they were delivering, low birth rate, any defects such as heart congenital anomalies, or even fetal demise. And we have a nurse that coordinates the case management with these families, reaches out to them and follows that child up to the second year of birth with various different steps that they go through with both providing resources and assessments for making sure the child's meeting developmental milestones and helping even with transportation challenges getting into doctors and things like that. So they case manage this entire group with it. And we get those referrals directly from the hospital. We reach out and that family can reach with us and work with us anytime during that second year. Our other program is Cane Cares. This is one of those home visiting programs that I talked about at coordinated intake. This is the one that we actually provide. This program is evidence-based. It's nurse family partnership. We know that for every $5 we spend on a client at this age, we're saving $8 down the line, or every $1 down here, we save about $7 to $8 later in life by helping those families get the resources and support with that child's earlier year. And the nurses work with that mom. These are for first-time pregnant moms in this program. They work with them before the 28th week of the pregnancy. And again, they're looking at moms that are low income, so mostly Medicaid. They might be new immigrants to the community. So some of these asylum seekers, we're working closely with those families with these programs. And any substance or domestic abuse, they'll be working with their highly trained and specialized in these areas. We've had a wonderful article we were written up in the Chicago Tribune that also got some wheels going for it. It was up in many of the postings, both on YouTube and also across the Midwest in many publications this last spring, interviewing one of our nurses, Christy Brown, in this program and her client, and the benefits that this program provides to the families there with it. Our immunization program is what we call a gap immunization program. So with the occurrence of the Affordable Care Act that got signed in 2010, there was the mandate that everyone has insurance, but there are still some insurances or some that are not eligible for insurance or on Medicaid. Maybe they had insurance and have gone since to Medicaid, but they had a private physician that does not carry the government vaccines. So we're talking vaccines for children or children's health and insurance program, which is called CHIP. Sometimes you'll hear that VFC or CHIP is the terms that they will use. So these are vaccines we actually receive from the federal government at no cost to provide to families that are uninsured, underinsured, or on Medicaid programs. So we don't carry a private vaccine stock that some physicians may have in their offices. So if the family's seeing a private practitioner that doesn't carry those government vaccines, they won't be able to give them, or they would be very expensive. They'd be out of their cost range to be able to cover. We will cover them at the health department. So we just provide the vaccines. We don't do assessments. We don't do physicals or anything like that. We just provide the vaccines and let them continue to stay with their private physician. We also provide flu vaccines to all the state and county employees. And we have a contract with the state for them and their retirees. We have a lead program, as Uche had just already mentioned with it. We do the case management. You can see the lead exposure risk map here in Northern Illinois, and you can see the highlights are in the Carpentersville, Elgin, and Aurora area. We have our highest zip codes with highest lead levels. So when a child under age 6 is seeing a doctor and they live in those zip codes, they will have them do a finger stick in the office called a capillary blood test. Once they get that, they send it to the state. We get a report back of that elevated above 5 or higher. And then the team starts to work on those cases in contacting that family and the doctor. I don't think that can, but the website I put right down there at the bottom, and you can look anywhere in the United States on it. So that's why I put that as a reference there for you. Once that elevated, we contacted the doctor, make sure they go in and get what they call a venous blood test. And if that continues to be elevated, then that starts to get the lead investigator out to the house to do the investigation, find out where that source of lead is, while the nurse is working with the family for diet activities and trying to mitigate what that source of lead is from, and working with those families for those follow-up blood tests to make sure it's continuing to lowering on down, so we don't have those levels continue to be elevated. So those cases can last anywhere from a few months to an extended period of time, depending on what we're working with.
Do you test the rest of the family as well?
The requirement is for pregnant women and for children under 6, but you can assume there's probably exposure to everyone that's in that family, with it. Our TB program is for all TB cases in the county. We get notified of those through mostly our hospitals and medical providers with it. We work with them. Some families will follow up if their insurance and are set up and things. They'll follow up with an independent physician, but we do follow all of those cases, making sure that they are treated, taken care of. We do the case investigation, contact investigation with the nurses down there in that program. And then we follow those medications are taken for about 9 months. And we do an electronic visual watch of each patient taking their medications daily by video now on our phones with it. So we can make sure that those treatments are taken care of. Historically, Kane County has got the history of the outbreak at Hesed House a few years ago. It's the largest one in the entire United States of a TB outbreak, and the team did a phenomenal job in that historically. Was well done with the CDC support and IDPH. So I think that might be my last slide.
Excellent. Thank you, Laura.
If you have any questions, let me know. And if you have any referrals to in those areas, please reach out to us.
Madam Bates?
Will the Mavis Bates, will the government supplied COVID vaccines continue indefinitely? Is that still funded?
Correct. Right now, we're still getting those without cost from the federal government. We are hearing, we know that funding is going to end at some point. We don't know when, but when it does, we'll probably have it most likely for our vaccines for children and our chip for our younger children, because we get those vaccines free from the government. But we don't have funding for purchasing private vaccines at this point, other than the flu vaccines that we give to our county employees.
Is that maybe something we should put in future budgets?
We have a lot we'd like to put in our future budget. We want that being one of them, yes.
Okay, thank you.
Add it to the list.
I'll just quickly go over, and again, this OCHR, DCHR is what we formerly called the Division of Community Health Resources. Again, this is the one that I'm going to be splitting into 2 separate divisions. So quickly, and we will give an opportunity for staff to come in, and we'll dig deeper into some of these programs in the future. We do have a tobacco program. The focus there is really how can we help people to not start using tobacco products. Of course, vaping is one of the biggest issues that we run into right now. How can we help residents of Kane County to quit smoking if they want to? So there's a free quit line. There's medications that work very well. There's things we can do in the workplace. So we actually have some grants that we have out available for the public right now for businesses who are interested in getting more engaged in that. We work very closely with Making Kane County Fit for Kids. So this is something that we launched through the health department. This is really focused on childhood obesity and physical activity and good nutrition. We launched this as its own 501c3 a few years ago because we just thought it would be much more competitive to get its own funding. So now the health department serves on the board, but we still provide staff support for that. That's been almost 13, 14 years that program's been going, and it's been very successful. We have an early childhood network, as you've heard of with a lot of our programs, preconception health and when kids are little is one of the absolute most important times. Home visiting, as Laura already mentioned, that's one of the best investments we can make. So many problems that we see later, including things that we talk about in all of these. So smoking, obesity, mental health issues, substance use issues, all of those things can be exacerbated by what people experience in early childhood. So anything that we can do to support our families so that we can create stable homes for people, and where there's not stable homes, things that we can do to provide resources for families is critically important. So the AOK network is all our kids' early childhood network. This is where IRIS really lives. It's a partnership across the health department, but that's our electronic referral system. So I'd like to focus on that a little bit more next month if we can, because it's just a really dynamic program. Children's mental health, we have a 7-year grant from the Illinois Children's Healthcare Foundation where we're really building a system of care. So I've talked about that in the past, and we'll spend more time with that in the future. We have a grant from the state. We actually have 2 grants from the state for opioids. One grant is to provide naloxone to our community partners. So we started out years ago providing it to police departments, but now we've really expanded and we're working with a lot of different organizations. The problem with opioids just is getting worse and worse. And fentanyl is being involved in more and more overdoses, including what people think they're not using opioids, but somebody may use cocaine and have a fatal overdose because it includes fentanyl. Julie Mann just shared an article with me that the DEA seized enough fentanyl last year to kill every American. You may have seen some of the graphics where they say this is what a lethal dose of fentanyl is, and it's not very much. So this is something that's very scary to people. So we're working with fentanyl test strips and different proactive ways that we can get out and save lives. Workforce development is something we're looking at with training. That's one of our key priorities. Early childhood mental health consultation. This is a program that we took on a couple of years ago. Again, just the importance of young people. Our customers in this case are actually childcare centers in DuPage County and Kane County that we work with. So we've got 2 great consultants who are out working with the center. So a center may call and say, hey, I'm having trouble with this kid. And this is the same thing I think, I'd ask everybody when we talk about these issues. It goes for small children. If you've got a 4-year-old who's really disruptive, it seems like the easy thing is just kick them out of the program. And again, I say this about adults too, like they're still here. They're still in our community. So kicking that child out of the program, that child is still going to be in our schools. That child is still going to be in our neighborhoods. So they may be getting into worse trouble for themselves and for other people around them. So the more we can do to support people, to try to get people on the right path, so to speak, is very valuable. So this team does a great job with that. Our public health emergency preparedness folks do a great job. Certainly everybody really stepped up during COVID, but we do CPR training, stop the bleed training. We have our medical reserve corps. We were one of the first medical reserve corps in the country about 20 years ago. And our volunteers, we can't thank enough because they did so much for us during COVID and the thousands and thousands of hours that were volunteered by Kane County residents who had both clinical and non-clinical backgrounds to step in and help was just fantastic. We'll talk more in the future about what we call our CHA chip. So CHA is our community health assessment that we do every 3 years. And after we do the assessment, then we develop the CHIP, which is the Community Health Improvement Plan. Our top priorities right now are mental health, really looking at prevention of chronic disease. So we have a work group that's nutrition, exercise, and healthy weight. We have access to healthcare as an issue, and transportation is a big piece that we've really highlighted there. And then we also have communicable disease as one of our things. So that's a community plan. So the health department, we're required to do this every 5 years. We partner with our 5 hospitals here in Kane County and the mental health board down in Aurora to do a joint assessment. So we're all sharing resources and using the same data. But again, you'll hear much more about that as we move on. Epidemiology, this is our non-communicable disease epidemiology. So Uche referenced the disease tracking that we do. This is looking at chronic disease, substance use, mental health, et cetera. And then we have a fantastic quality improvement coordinator where we're constantly looking at how can we do things better. And Claudia also really helps keep things together as we look at accreditation. And I want to give Claudia credit. I had some slides that weren't near this nice. And we just had our employee quality improvement newsletter just came out, and she had these nice, just happened to have a nice set of things on the people I was going to be talking about. So
Timing.
thank you to her. Yeah, that was great. So this, again, I'm going to split into 2 just so we can get better at getting data out to people, and because there's so much that we need to do around mental health, specifically in community health, that I think having a person who's able to focus more on that is going to be really important. But happy to answer any questions about any of these programs. Excellent.
Anybody have any questions?
The workforce development, is that specifically to the health department?
It is. That's a
Okay.
part-time position that was created a couple of years ago that's really focused on internal training and onboarding and things
Okay.
like that.
Thank
Yes.
you. Bates here.
And of course, that's not a one-time offer to answer questions, right? Anytime you have questions, let Michael know. He'll be happy to answer them. Okay, any questions? That was a great overview. Thank you very much.
Right. It's a lot of information, but we figure at least so you can see it once, and then as we dig in, if there's anything that pops into your mind, we're happy to provide more information. Just a couple of quick highlights. COVID, we are still experiencing a bit of an increase. So if you look at the slides over the last couple of months, we were down below 60 cases a day. Now, as of yesterday, over the past month, we're averaging about 111 cases. So since Thanksgiving, it's about doubled. We had a little higher peak right after Thanksgiving. Hanukkah started, we're headed into Christmas. So there's a lot of gatherings that we're still doing. There's a lot of things that go into this. So drier air, us all being inside, getting together. There's a lot of things that make spreading viruses easier this time of year. So we do urge people to still take precautions, especially if somebody has health conditions that may put them at more elevated risk. And thank you for modeling, Mavis. Love it. I unfortunately just had COVID, so I'm okay.
Michael,
Yes, sir.
how do you get that number? How do people report to you how do you get the COVID number?
Yeah, thank you. And that was actually going to be my next comment is
Sorry.
this is, no, you're good. So this is only cases that are reported to us. So it's mostly what's going through the labs. So that means for home tests, which are widely available now, and actually we have some great programming where we can get it to people who may have trouble accessing it, but the federal government has made tests for free. Those aren't included in these numbers. So this is actually a low ball of what's actually happening in the community, right? And even when all the testing was being reported to us, we know there's plenty of people who don't test that still get COVID. So there's at least this many cases that are out there. We recently moved up to medium community level. So again, this community level is a CDC designation that looks at not only how many cases you have, but how many people in the hospital have COVID and how many new admissions are due to COVID. So it's kind of bigger, like what's the impact? So we were a level lower and just moved up, but transmission is still insubstantial. There's plenty of COVID going around. So vaccine, strongly encourage people to get vaccinated. That's the best thing you can do. Stay home when you're sick, and it doesn't matter if it's the flu or a cold. Nobody likes a coworker who's sick. Nobody wants you showing up at the party when you're sick. So if you're sick, follow guidelines. It's good for people to test so that they know if they have COVID so they can follow the proper precautions. And then washing hands, increasing ventilation helps a lot. And then face coverings, I know it's been a hot political issue over the years, but can be very effective at reducing spread. And again, if people have serious health conditions or if they're around people with serious health conditions, it's just one more thing you can do to protect people. Any questions on?
Question, please. What about hospitalizations?
So,
Dates, please.
yeah, so hospitalizations have finally started to come down a little bit. So
Have they been high?
I wouldn't say high, but they were elevated. But we also, and I've got a slide here in a moment, we've had RSV and influenza have been keeping people pretty busy. So fortunately, the COVID hospitalizations are okay right now. But again, just in terms of if a certain percentage of COVID cases end up being serious and leading to death or leading to hospitalization, the more cases there are, the more people that we expect. So after this upcoming holiday weekend and with everybody home and things like that, we'll be keeping an eye on that.
And it
Definitely.
does seem like after 2 years of no parties, everybody's having parties.
Right.
So
Definitely.
smart when you go there.
Yeah. I just am mentioning Ebola because it's something that's been in the news and hopefully this will be the last time that we it won't be the last time ever, but I probably won't highlight it. But just so you know, for the newer members, we do monitor people who come from areas where outbreaks are occurring. So as they come in, they're identified, our staff reach out, contact them and monitor them for 21 days. We haven't had anybody who's a high risk traveler yet. And we've had 11. I think 11 is still our number. 13 now, 2 more. We just had 2 more. A couple people moved out of the area though, so that's nice.
What are the high-risk
Yeah, go ahead.
areas?
If you want to add. Okay.
What are the high-risk areas?
So it's
Ebola.
different
Oh, sorry,
states in
Yeah.
Uganda. No, it's not on the slides. You're fine.
not Argentina.
Yeah, but it's also one of these things where, like, if there's an outbreak going on in Aurora and I travel somewhere from Aurora and they'd say, I'm from Aurora, I may not have been anywhere near anybody who was sick. So this is very much a precaution that we're taking. And then we monitor people for symptoms. So we have a good system in this country. But Uche, you want to add anything on that?
Yeah, so with Ebola, like hopefully, Michael, if nothing happens in another, so we have 23 days and counting, we might be over the Ebola outbreak that's currently going on. So we're kind of watching with bated breath that, no new cases in Uganda, and then we'll be free.
Yeah. So fingers crossed. There's always something new. So there's Zika, West Nile virus is new. So bacteria and viruses are always going to be with us. This slide is showing the percentage of emergency room visits for influenza-like illness. So our team meets with our hospitals every week to talk about what's going on with respiratory illnesses. I just think this is important to point out. So this light blue line is showing this year, and this is 8 years of data. So you can see, even though we're on a nice downturn and there's a delay in getting all this data. So this is representing November 27th to December 3rd. 15.9% of ER visits were attributed to influenza-like illness. So even though we're on this fantastic downturn, we're still almost higher than we have been in the last 8 years for these. So again, with COVID and RSV, which also RSV has been on the downturn, but there's a lot of viral activity out there. So, just encourage people and washing hands, that kind of stuff. It really does help to reduce transmission. So we do stay in contact. Again, we're just getting into typically when the peak will start is later. So hopefully we're seeing an early peak, but we'll be monitoring that. And this is posted on our website, and we can send an email that has the full report. I just pulled out one chart that I think is illustrative here. And that's just high level. We'll talk, there's a lot more to talk about, but we're trying to pack it into an hour here. So that's it for the overview. Happy to answer any questions. We've got another committee that meets after ours that wants us to be on time. So.
Not going anywhere for a while.
Right.
Excuse me, this is David Young. Have you
Yes, Mr. Young.
have you recorded or reported any of the side effects of the mRNA vaccines that have been reported? Like, there have been a lot out there, and just want to know if that's been reported out to the public through the health department.
Sure. So there is a national program that tracks any adverse outcomes that people have. And if you came to any of our clinics, we would give people information about how they could sign on and register for that. Laura, do you want to say a quick word about VAERS?
Yeah, it's called VAERS, VAERS. You can certainly Google that and make your own report if you have any symptoms or side effects from any vaccine, including the COVID. And that is recorded and compiled in a database. CDC looks at that, and that's where they look at some of those warnings that we got for like the myocarditis for those cases and things like that. That's where that's all kind of bubbling on up from, is those reporting. Physicians, medical providers are required to report those also. So they may also be reporting those, any side effects that might be going on if you're seeing a physician too.
Yeah.
Would you repeat that website?
It's VAERS, and it's Vaccine Adverse Event Reporting System, I believe is what it's called.
Thank you.
And
Mr. Chair.
are you reporting that too? I mean, is that something that you send out or put on a newsletter or on your website? Do you have a link to that states specifically, here are some side effects that have been experienced by taking the mRNA vaccines? Do you have anything on the website, your website?
So on the canevax.org website, it has the fact sheet, and those are updated as every update comes through with the vaccines as we get new recommendations for the emergency use. In there is details of all the expected or anticipated side effects for each vaccine. When the COVID vaccines, with the exception of the Pfizer, who received the actual approval, has a vaccine information sheet. So any vaccine that you ever receive, you get a vaccine information sheet. It's called VIS. You're mandated to give those as a provider that's giving vaccines to anyone that receives a vaccine. So you should have gotten one when you got your flu shot. You should have gotten it for your tetanus shot. Those vaccines, and those are also readily available on the internet too, through the CDC, and you can just Google vaccine information sheet and you can find all the vaccines that we give in the country and all the sheets. And it does have on those all of your side effects that are anticipated. It also has that VAERS location on there to report any, because you can self-report, or the physician or medical provider can self-report those too.
And I'll point out, this is much better at a national level, because this is something where if Mike and I go get a vaccine and then I get sick the next day, we don't know, with a denominator of 2, we don't know that I'm sick because of the vaccine. So especially with COVID, the benefit is we've had millions of vaccines that have been given. So we have a really robust data set. So when we look at each of those fact sheets, including with the mRNA vaccines, we can really see, okay, this is what's happening across the community. And still what we're seeing is that the benefits of being vaccinated are far outweighing the risks. But even though it may not be a perfect system, the system we have in the United States is very robust for how we evaluate drugs, how we provide that information to people. So all of those drug sheets that Laura mentioned, I think are very valuable to reference.
Thank you. Mr. Jarrett?
Thank you, Madam Chair. I just wanted to point out a bit of a caveat with the VAERS system, just because there are adverse events reported in there, as Michael kind of indicated. There's no direct connection. There's a correlation there. Yeah, I got a vaccine, and then a couple of days later I had fever, maybe got hit by a bus, something like that. There's a lot of twisting of the facts in the VAERS system that turns into, oh, the vaccine causes all of these other things. Well, that's just almost anecdotal data that's reported, and it has to be verified. So just a caveat for anyone that's looking at that data set to keep in mind.
That's a very good point.
Madam Chair,
Yes, Ms. Bates.
do we have data on how many lives the vaccine has saved so far?
There's estimates. There's a lot of studies out there, and what we do when this goes for adverse events and also for lives saved is one thing we can do is look at comparing who was vaccinated to who was not vaccinated and what the outcomes were there. So that's one way we can get an estimate. But of course, everything is much more complicated than that because we're mingling in different areas. We live in different parts of the country. In some places, people were good about wearing face coverings. In some places, people really stayed home. In other places, people went around and carried on their business as normal. So there's a lot of variables that make it imperfect. But there are some estimates out there.
What do you think those estimates are?
Oh, I could look it up.
I think
and
it's
share. Yeah,
way
it's a
in the
lot.
millions.
Oh, yeah,
Definitely in the millions. Okay.
definitely. And because most people are vaccinated right now, we're seeing a lot more vaccinated people who have COVID, but we know it's reducing their severe illness, hospitalizations, death, et cetera. But say a year ago, we were seeing the chances of somebody dying from COVID who was unvaccinated was like 18 times higher at one point.
Okay.
So it's as this goes on, the numbers change as more people are exposed. But yeah, many
Thank you.
lives saved, definitely.
Any other questions? Okay, next we have a resolution.
Great. So we'll start with the resolution for accepting a grant for embedding peers in emergency departments. This is really exciting. We had started and actually as I spoke with Chair Strathman and Vice Chair Sanchez on Friday morning, I said, well, this is a just in case because we haven't heard about this grant. But because it starts and because our county process takes a little time to get permission to accept the grant and things like that, sometimes we'll put a grant forward for your approval so that we can enter into the agreement just in case we get the award. And this is actually a grant. I was looking at last month's presentation. We just applied for a month ago. And Friday evening, we were notified by the National Association of City and County Health Officials that we will be getting this. This is a $300,000 grant. That's a one-year grant starting in February. In the application process, they said they intended to only fund 5 across the country. So I actually said this is kind of a long shot. So we're really excited. 1 of 5.
Let's deserve a round of applause.
Well, I mean, the work is we got to roll up our sleeves and get the job done, but we'll take the check. So looking at the resolution. So whereas according to the Centers for Disease Control from 1999 to 2020, more than 500,000 Americans died from opioid overdose. Whereas in 2021, there were 419 overdoses that included transportation to Kane County hospitals. And the Kane County's coroner's office reported 99 fatal overdoses, which, side note, is an increase year over year over the last several years. Whereas as part of the 2020 comprehensive community health assessment conducted by the Kane County Health Department, mental health and substance use were identified as top health priorities. And whereas Kane County Health Department has applied to receive funding from the National Association of City and County Health Departments, and now has been granted this money in the amount of $300,000, whereas the funding will allow the health department to carry out activities to increase access to effective treatment in partnership with local hospitals and providers to reduce overdose-related mortality. Now, therefore, let it be resolved by the Kane County Board that the chair and the chairman that therefore be authorized to enter into an agreement with the National Association of City and County Health Officials for an amount not to exceed $300,000. So very exciting.
Very exciting. I'd like to have a move and a second to move this forward.
Sanchez moves.
Silva seconds.
Okay, Sanchez, Silva. Please take the roll.
Juby,
Aye.
Silva,
Yes.
Tarver,
Tarver, yes.
Williams,
Williams, yes.
Young,
Young, yes.
Strathman,
Yes,
Sanchez,
Sanchez, yes.
passes.
Yes.
very exciting.
Excellent. So we'll share more detail about this, but this is really looking at taking peers with lived experience, partnering with the hospital emergency room so that when someone comes in with an overdose, they can connect with somebody and increase the chances that they're going to successfully get into treatment. So, and it's been proven to work in other places.
Anybody have any other discussion they'd like to talk about with this? Okay, we'll be getting more information from Michael as we move along with this. So we have another resolution this morning.
So the second resolution is authorizing opioid response community implementation projects. So we do have a grant from the Illinois Department of Human Services that allows us to make funding available to local community partners. This resolution, the reason we're bringing this is because two of the grants that we're suggesting that we provide to the community exceed $30,000. And with county rules, I can, as a department head, I have authorization to do under $30,000, but we need county permission, county board permission to do anything over $30,000. So I just wanted to go ahead and share all the information about all the projects. We did a competitive request for proposals and evaluated those based on how well they fit what we were asking for and what we thought the scope of good that they would be able to do is. So a lot of the upper part of the resolution is the same. So I'll get down to whereas the Kane County Health Department carries out opioid overdose response strategies through the Illinois Department of Human Services state opioid response grant. Whereas these activities are essential to combat the opioid epidemic and reduce overdose related mortality for the residents of Kane County. Whereas Kane County Health Department issued a competitive request for proposals to identify projects that will reduce overdoses through community-led efforts that include improving access to naloxone, increasing utilization of recovery coaches, conducting street outreach, utilizing harm reduction strategies, and enhancing linkages to treatment opportunities. So now therefore, let it be resolved by the Kane County Board that the Health Department be authorized to purchase contractual services for the amount not to exceed $165,300 and include the following projects. African American Men of Unity, $25,000. Association for Individual Development, or AID, $35,000. Echo Development Center, $20,000. Ecker Center for Mental Health, $18,000. The Kane County Collaborative Diversion Program at the State's Attorney's Office, $15,000. Lighthouse Recovery, $40,000. And the Path to Recovery Foundation, $12,300.
I'd like to have a move and a second.
Sanchez moves.
Sanchez moves.
Silva seconds.
Silva seconds. Any discussion?
Madam Chair, I'm not on the committee, but I do have a statement.
Yeah, sure.
In
Ms.
reference to the Narcan, I've been doing some community outreach and speaking at many locations in my pipe world dream here, which I know I do not see the irony in that. It has been discussed that the outreach programs are putting Narcan boxes on trees, on, locations that you wouldn't necessarily think of. Now, I submit to you that if you put those at every location where there's an AED, where our people are already educated on where those are, and you look everywhere, there's an AED machine, that's something that I think needs to happen. So my 2 cents on that. Good work.
Thank you very much.
That's a very good idea. Is that happening?
I know there is discussion on it. I don't know how far it's gotten. Michael might.
Sure,
know
we're
more.
still working through some of the legalities on some of it, but things like naloxone vending machines are popping up more across Illinois. It's unfortunate that we're in this situation, but I guess you could say it's unfortunate we need AEDs all over the place too, but it is a way that you can save somebody's life. I completely agree with Ms. Combs.
Yeah, and there is a little data suggesting that actually naloxone saves more lives than an AED does. And it sometimes can be incidental lives that are saved too, because there's always a pushback from people that are like, well, they don't understand the disease. But incidental exposure, for example, an officer who's just taken somebody into custody, and recently, I think maybe last week, there was an officer that had blowback of fentanyl in their face, and they had to give her 3 doses of Narcan, and I don't even think that worked. But those are incidental things that benefit society as a total. So
To me, that's thinking outside the box, and that's a great way to approach public health.
Definitely. And we'll share a lot more in the future about these programs. There's some exciting leave behind programs that we're piloting in multiple communities where there is an overdose, and we know someone's an active drug user in that home or in that location where we can leave it. And again, this is a very complex issue, and it may be frustrating, and for families, this is hard dealing with somebody who may be an active drug user, but we're trying to get them out of that. And so it's not simple. It's not just a one-step thing, but we need to keep people alive so that we can get them out of it. So yeah, really important work.
Be nice to have that program to eliminate the other programs, so we don't have need for either one.
Yes.
Be nice. Rings.
Madam Chair,
Yes, Mr. Tepe.
Deputy, I'd like to make an observation about this. One, I'd like to share that, in my opinion, the health department has done a tremendous job in really creating relationships throughout the county with the 501c3s and other organizations that provide services. And in doing that, they also know where those gaps are and where gaps in services are in this instance. And I really want to applaud them for this effort, but also want to encourage that the more we can funnel things through the health department where they can work with their contacts in this area, the better results I think we'll get throughout the county. Thank you.
Very good point. Very good point. So with that, we'd like to take a vote. Please call the roll.
Juby. Aye. Silva,
Yes.
Tarver,
Carver, yes.
Williams,
Williams, yes.
Young,
Young, yes.
Strathman,
Yes.
Sanchez,
Sanchez, yes.
Happy,
Pepe, yes.
passes.
Okay. And then I'd like to move on to our animal control report this morning.
Good morning, everyone. I know we're running late, so I'll try to cut right to it. All my reports are on file. If you have any questions, please let me know. I'm always available.
You introduce yourself to the new people, please?
Yes, my name is Brett Youngstead. Just so everybody knows real quick about me, I have a doctorate in veterinary medicine. I am not the county veterinarian, though. Dr. Jane Davis is. I actually oversee all operations of the animal shelter, from field operations to medical to sheltering into front desk operations in our offices. It gives me a very unique perspective having my degree. It allows me to really have hands-on every single thing that we do inside this department. I'm the longest tenured since this building has been built. It was 16 going on 17 years ago. I've been here about 8.5 years now. Love this county. The support behind this county for animals is amazing, and I'm honored to work here every single day. I will bring Dr. Jane Davis one day with me here so you can meet her. She's fantastic. She's one of the heads of biology at Aurora University. She's an amazing lady, very good at what she does, and a pleasure to meet. We are a small department of 15. 4 of my employees are part-time. Dr. Davis is one of them. The other 3 are part-time kennel workers. I encourage everyone that has never been there to please come visit our shelter. I would love to give you a tour. I'd love to show you around, show you what we do, and show you what we have available. We do take emergency care very seriously, and I've built an emergency trailer since working here that we've gotten up and running, and we've been taking it to events over the last 2 years, which has been fantastic to show out to the community. Other things is a reminder that winter is here. We have strong conditions coming. Please remember, if it's too cold for you, it's too cold for them. If it's too cold for you to be outside, then it's too cold for your animals to be outside. But keeping in mind, some of our furry friends do have undercoats. Some of our Siberian Huskies, our Malamutes, our Pyrenees, they love the winter. This is actually their season, where if you talk to owners of these animals, they can't get them in, versus the summer when you can't get them to go outside. Summer is terrible seasons for them. It's more of their winter is summer, and their winter is joyful to them. So some of these animals are outside, love it outside. Please just be careful when you're calling to complain about your neighbor. Always remember those things, because we do have a lot of complaints at this time of year. We do a lot of well-being checks. We love doing well-being checks. It gives us a chance to also talk to the members of the community, speak to the community, and find out what's going on out there. But again, if anybody has questions, concerns, please let me know. I am always here for anything you ever need. And I love talking to people. So hopefully that helps.
Madam Chair Silva.
Yes, Ms. Silva.
Good morning. Director, I'm just wondering how things are going right now with the overflow of animals. I know Aurora Animal Control is doing a temporary fostering program for just to, I believe, to get the animals out of the cages. I know we don't have staff for that, as you've mentioned in the past, but wondering how things are going with the overflow of animals. Are we seeing that in King County?
Yes, we talked about it a little bit last month. We did the press release about the overflow of animals, and I know that More and more shelters have been stepping up to also do their press releases. It's just a terrible time right now with animals flowing back into the shelter faster than animals are leaving the shelters. And it's not only us. Paws Chicago, Anti-Cruelty Society, City of Chicago, Anderson, Aurora, they've all recently done articles similar to ours about how full they are. We're doing the best we can to control that. We're starting to see a lot more abandoned animals. DuPage, we were just talking to, has had cats left in carriers left and right outside their doors. It's just a bad time for animals. It's a bad time for the economy, a bad time for people, and our industry is trying to do everything we can to keep up with it. We are comfortable at our facility right now. I say comfortable because I don't want to be too optimistic, but we're always controlling our situation the best we can, and we like to stay on top of it. So we control our owner surrenders. They're booked out until February was last I heard. So we're doing everything we can to bring animals in as fast as we can to people that have situations.
Thank you.
Thank you.
Any questions?
Madam Chair.
Yes, Ms. Gums.
Sir, can you tell me, is there any correlation to owner surrender and homelessness? I've been doing a little digging into this topic, so I would be curious to get your perspective. I mean, are homeless folks turning these animals over during inclement weather, let's say?
Not as often as you would believe. It's more people that have to downsize, people that have to change jobs, people that have to move. Homeless people are usually very tight to keep their animals. We have brought them in. For my time at City of Chicago, my time here, I've taken in my fair share of homeless animals because those are animals we need to prioritize immediately. We push them to the front of the list and bring them immediately in, but not as many as you would think. People are, they're family. And it's hard to give up a family member, especially in those trying times. And I don't blame people for that. So no, we don't see it as often in the homeless, but we are very cautious and aware of those situations to make sure that those are prioritized.
Excellent. The reason I ask is I'm working on a little initiative to get our homeless shelters and also our domestic violence units, which is really not related here, but there's only, I think, one facility in the entire state of Illinois that allows a domestic violence victim to bring their pet. And that's kind of a problem. So
there are some shelters that do boarding for those types of situations. If you reach out to me offline, we can talk.
perfect. Thank you.
Thank you.
And can we adopt as county board members for like 2 days over the holidays?
Yes, I'll just put them in your car, just drive up. Well,
Meet you over there. All
little
right.
foster home.
All right.
Thank you. That's wonderful. Count me in. Silva.
Everybody check your cars before you leave today.
My car's locked.
Those are four.
Thank you. Thank you.
Thank you.
I don't think we have a need for executive session.
Yes, we do.
Closed session minutes.
We do have a need for closed session, and I'd like to have a motion to go into closed session.
I'll make the motion.
Okay, Mr.
Silva. Silva
Williams.
second.
Mr. Williams,
Review of closed session
for
minutes.
the review of closed session minutes.
Very free. Good morning. Something I never hear. Dental. Better. And I've been here a long time. Primarily in relationship to low.
Getting there.
So you might want to talk about that.
We do have programs that
Oh, I can't imagine you walking away.
I think she had her plan set up.
Yeah, but her family is all COVID.
Okay, so we need to take a
Still
vote.
works.
Okay,
It's a roll.
Besides that, it's
okay, I'd like to correct my, and we need to take a roll call to go into closed session. So clerk, please call the roll.
Which, by the way, I had told her.
Juby?
I forgot to take the roll to go into closed session. So we're correcting that now. We're going into closed session. So we're asking for the roll now. Ms. Juby?
Yes.
Okay, thank you.
Silva?
Silva, yes.
Now,
Tarver?
I need to get a flu shot. Yeah, where?
Yes.
take care.
Yes.
Oh, same to you.
Try.
Same to you.
I'm under extreme pressure.
Young?
Let me know.
Where or else?
Young, are you with us?
Where I don't.
Strathman?
Yes.
Sanchez?
Sanchez, sure.
Tepe?
Pepe here. Or yes.
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 Okay, everybody online that's coming with us into the closed session, please accept the invite. Be aware we are live streaming. So until I give you the okay, anything you say will be going out live to the public on YouTube. I'll let you know as soon as we're all together again.
You're a grandpa too, aren't you?
Times 4.
Fourth? Wow.
Where I'm putting this here.
They're making them younger, Vern.
Yeah.
I always advise people, when they get married to skip having kids and go directly to having grandkids.
Like, you can't help.
We're still waiting for a couple of people to join.
Forward.
Much nicer having grandkids than kids.
Oh.
Oh, sorry.
All right, you are in open session.
Okay, please call the roll.
Juby?
Yes.
Present.
Present.
Silva?
Silva is here. Silva is here.
Tarver?
Tarver's here.
Williams?
Williams here.
Young?
Young is
Strath? Ooh. Strathman?
Strathman here.
Sanchez?
Sanchez present.
Pepe?
Debbie here.
We have quorum.
And I will say, Madam Chair, on the Forest Preserve side, we don't have to take roll when we come out of closed session. So just throwing that out there. I don't know if there's a way we can do that.
Okay. I'm learning.
Ooh.
Okay, can I have a motion?
Sanchez makes a motion to vote on the release of closed session minutes as shown in Exhibit A.
Williams second.
Ms. consent.
No, vote.
Okay, please take the vote.
Juby?
Yes.
Silva?
Silva, yes.
Tarver?
Tarver, yes.
Williams?
Williams, yes.
Young?
Young, yes.
Strathman?
Yes.
Sanchez?
Sanchez, yes.
Pepe?
Debbie, yes.
Yes.
Okay, now I'd like to have a unanimous consent to place the reports on file.
So requested. Sanchez.
Second.
Williams second.
You don't need a second, just.
Oh, I don't
there's
need a
no
second.
objections.
See how much I'm
Oh, yeah.
learning today?
Yeah.
All right.
No
Okay,
objections, then it passes. Then it's on file, so.
okay, so the reports are on file.
Yeah.
Okay. Okay, any new business?
Madam Chair Silva?
Yes, Ms. Silva, Dr. Silva.
Thank you. Just quickly, thank you for your leadership. This feels like a new era, so I am so excited to see where this goes. And I'm so excited to work with you. And I'd also like to thank our past chairperson, Mr. Sanchez, and all who worked through such difficult times and stepped up during the pandemic. I think you all did a phenomenal job. And it was unprecedented times, and our leadership really showed. So thank you all who were involved.
Thank you, Dr. Silva. And I'd just like to say that Mr. Sanchez has agreed to help me make this transition. And I'm very excited to be sitting on the Public Health Committee. And with your help, I think we'll do a great job. So we're looking forward to having a lot of great programs this next year. And with that, I'd like to have a movement to a motion to adjourn.
Sanchez moves.
Williams second.
Okay, all in favor?
Aye.
Aye.
Okay. First one's under the belt.